How do you see and understand neuropsychological testing?
Neuropsychological testing is not something that is very commonly heard of within our community.
Hmm.
And neuropsychological testing is often something that physicians might refer you or school might refer children for. And it covers a variety of things. Usually, when you come in for a neuropsych testing, it's something that you are working with a psychologist on, and the psychologist is trained, should definitely be trained in neuropsychological evaluations. So there's a whole process that psychologists have to go through to be trained in that process. And the training emphasizes being able to learn about brain and behavior and the intersection of brain and behavior. So they are able to look at different aspects of functioning of the brain and then predict how that's impacting your everyday behaviors. So, when you come in for a neuropsychological testing, what you're going to expect is it is going to be a long process. It's
Hmm.
not something that is short. It's not something that, like a blood test, where you go in and you're in and out in 15 minutes. It requires you to be there at least for 2 hours, if not longer, depending on the question. So, typically, the psychologist first will go over the history with you, will go over getting the background information on what issues you're having. And then they'll ask you to participate in some paper and pencil tests. And these are standardized tests that are used to compare people of a similar background, similar population, education. And based on that, then there's the results indicate whether you're having difficulties in certain areas. So typically, neuropsychological assessments, at once the assessment is done, the psychologist is going to prepare a report and have recommendations for you, and those recommendations is something that they will discuss with you and see how they can help you in maximizing your everyday functioning and also try to reduce any barriers that you're having. When a child might show some autistic symptoms, we're very likely to say, oh, it's nothing. Let's just try and ignore it, or it'll go away as they get older.